So how can caregivers address all the roles that they have to carry out and the stress that comes along with it? A lot of these things, I think, are suggestions that most caregivers already know. They've already heard. They know that they need to take care of themselves and maintain their own health and do these things, but they really are very, very critical, and sometimes it just takes a healthy reminder to do these things. But self-care is important. Maintaining your health, getting to your own doctor's appointments, and making sure that you're staying as healthy as you can. It's hard to carve out time for exercise, and it's hard to always eat healthy, but these things are important. Trying to seek support, whether that's through groups or friends or your church or your neighbors, wherever you get support, utilize that support. I think caregivers really benefit from talking to other caregivers, talking to other people who get it, who can validate their concerns, validate their frustrations. And I feel like when you put a couple of caregivers together, they all just naturally understand where the other is coming from, and they don't necessarily feel like they need to fix the situation or do anything, but they can just be there, be a support, and validate those concerns. And sometimes that's enough to make people feel a little bit better, knowing I'm not alone. There are people who get this. I'm not by myself. Taking an active role in your medical team is also really important, trying to absorb education and get information, especially if you're in this, I think I said 90% of people who take on a caregiver role and they feel like they have no idea what they're doing. Ask for help, ask for information. Don't be afraid to speak up. And also don't be afraid to delegate, allow others to help, get a break where you can. One of the best things that you can do to help care for somebody else is let them care for you. I think a lot of times people don't really know what to do or how to step in and help a family that's got somebody who's going through cancer, and so that can be kind of a helpless feeling. So when you give them something to do or you ask them to help you, you're actually helping them. So sometimes that reframe helps as just a reminder that it's okay to ask for help from others and to delegate and try to get a break or some respite where you can. It's also really important to try to prioritize what's most important, kind of letting back burner things stay where they are, making a list and sort of prioritizing 1 through 5 or 1 through 10 or whatever that looks like, and remembering that it's okay to say no. You don't have to say yes to every request, and I think people will just have to understand that, it's a stressful situation to be caregiving, and you just can't take on more than you can chew. In fact, if you're caring for somebody with cancer, you probably already have more than you can chew and more on your plate than you can manage, so it's okay to say no. For caregivers with kids, it's going to be important to find whatever resources in your community for childcare services. We encourage caregivers to ask for help from their families to help out with kids. Knowing what some of this research is saying about how much of a burden it can be to be caregiving, working, and caring for kids at the same time, I think we really need to encourage caregivers to get some help around their parenting roles as well. So that's another important aspect to addressing the multiple role stress. So one of the things that we talk a little bit about as far as kind of treating the emotional exhaustion or some of the psychological stressors of caregiving is to do what's called a gratitude exercise. And so I'm going to play this video here that sort of explains what this means.
I want to talk a little bit today about gratitude. It's one of the most well-researched components in positive psychology. And to think about gratitude perhaps like hygiene. You brush your teeth every day, you take a shower every day, that kind of thing. And if you can include maybe 2 minutes of gratitude, the impact will be tremendous. So I want to share a technique that has been very helpful. There's some good research on pieces of this, so I'd like to pass it along. You can do it either at the end of the day or at the beginning. And what you do is you think back over the last 24 hours and you review your day and you ask yourself what you have gratitude for. And you think about as many specific things as you possibly can. And you'd review that last 24 hours and identify each component that you had gratitude for. If you were waiting for a check and it came, if one of your kids got a good grade in school, anything that would be specific would be good. Then think back over that last 24 hours again and think about anything that you're proud of, that you've accomplished or that you've done during that time, and identify that. So we have gratitude over the last 24 hours and what you're proud of over the last 24 hours. And then think ahead. What are you looking forward to in the next 24 hours? I know these three things sound incredibly simple, but what we know is that if you do this on a regular basis, it starts to change the frame of your thinking. You start recognizing that good things are happening on a regular basis in your life, that there are things that fill you up that you feel good about, and that there are things you're looking forward to. It has the power to reframe our past, take care of our feelings in the present, and help us to look forward to greater well-being.
I hope everybody could hear that little blurb about how to use gratitude and a couple of exercises that you can do to incorporate gratitude into your daily life, and that this shows to have a positive impact on our outlook and our perspective when we take the time to think about the things that we're proud of, the things that we're thankful for, and the things that we're looking forward to in the future. And I think these are things that probably get pretty lost when you are stressed as a caregiver. I think even in an average day, when you ask somebody how their day was, typically it's the negative things that stick out. So even you could have had 15 good things happen, but that one negative is going to tarnish the day. And so I think the gratitude exercise is just something to help any of us, caregivers, patients can do this too. Just think about, all right, what are the blessings in my life? What are the things that I'm really thankful for? What things am I proud of, and what do I have to look forward to? And I think if any of these things, if what am I looking forward to comes up empty, that's a good sign that maybe we need to start building some things in to look forward to, some positive experiences, so that we have a reason to keep going and keep moving forward. And I think that's a key piece to doing something like a gratitude exercise. Is it helps remind us of the really important things in life that are good and aren't necessarily challenging, but are things that are blessings. People tend to do this in lots of different ways. Journaling is one way that you can do this exercise that if you did it daily, or not even daily, once a week would be great. Sit down and just write out over the last 24 hours, like the video explained. You could do that through journaling, through writing. You could just I've heard patients say that caregivers say that they do it as a form of prayer, kind of before they go to bed, thinking about what their blessings are, what they're thankful for, what they're proud of, what's coming up in the future. And there's also, some meditations out there. You could look up online or Google gratitude meditations. There's lots of those out there. Or if you're just taking time to kind of be quiet and rest your mind, you might incorporate this into some kind of relaxation or meditation as well. So there's lots of different ways that you could incorporate an exercise like this in your daily life. So some of the common caregiver needs that I hear that come up a lot include wanting more information about legal advice, information about drugs and medications, help with addressing end-of-life issues, advice with moving a loved one to, for example, a hospice facility, family help, information about what all the services and resources are that we have available, how to cope, how to manage stress, financial issues, information on, the cancer itself, learning how to be a caregiver, communicating with professionals. I mean, the common caregiver needs are pretty endless. And so there are a few ways that I think we can try to address some of these things. And I think using your medical team as a source of support and source of information is always key. Remembering that, I'm going to skip ahead really quickly here to this list that, when it comes to your medical team, there are social workers, nutritionists, nurse practitioners, clinical pharmacists, financial counselors. If you have a question, there's somebody who can answer it. And if they can't answer it, they can help you find somebody. We also have the Legal Aid Society of Columbus does some pro bono work. I have a lot of patients and caregivers that are like, I need to talk to somebody about legal advice or like making a will, and I don't know where to start, and I can't afford a lawyer. This is just one resource in the community I know that offers some assistance around that. And just some other things. The Cancer Support Community has this pretty handy document that has some tips for caregivers. I'll see if I can pull it up just really quickly here. So if you go to the Cancer Support Community and look up like the 10 tips for caregivers, they go through some tips, some of which I've covered tonight, but I think are just general good things to keep in mind, like making sure that you get connected and find support, getting information that you need, embracing your new normal, and sort of, I guess this is just kind of a recognition that you may not be able to do all the things that you were accustomed to doing before you were a caregiver, and trying to prioritize and accept, I guess, your new role. They also talk a little bit about taking breaks and reminding folks that it's not selfish to take a break, that you actually need to do that. Remaining involved with your friends and family and trying not to isolate. It can be pretty easy to kind of withdraw and pull back when feeling stressed. Making plans for the future, learning to say yes, which is interesting. I think we talk a lot about making sure you know how to say no, but also saying yes to help and to support. There are some other, staying healthy, finding new ways to control stress, and setting limits. So I think in a nutshell, this document sort of I think does a nice job of highlighting just 10 basic things you can do when feeling stressed by multiple roles or feeling like you're getting pretty bogged down. And then there's, of course, the things that we have going on at the James. James Care for Life has great programming, like things like this for caregivers, support groups. A lot of the programming, whether that's getting involved with the local garden or doing some kind of exercise or cooking class or it really ranges. Music and art therapy, all these things are open to family members and caregivers too. So, sometimes I think people see these programs and they think like it's just for the patients, but it's for caregivers too. So I want people to know that there are lots of resources. And the James Care for Life program can be found online. You can call and sign up to get on a mailing list to get that. Anytime you're in the James, they're floating around everywhere. Sometimes I feel like they aren't seen unless you're looking for them, but they are. The brochures are there. The James also has an online cancer community called Cancer Connect, where it's kind of like cancer Facebook, I guess, in some ways, but caregivers and patients can get on there for support. And then things like Caring Bridge are, I think a good way for caregivers to disperse information. So Caring Bridge is kind of like a blog or a place to journal, and people can follow your posts. So you can update on what's going on with the person you're caring for and have everybody kind of go to one place to get that information instead of feeling like you have to deliver the information to everybody. And then kind of similar to Cancer Connect, is Immerman Angels, which is a one-on-one peer support program. So you can sign up. It's a national program, and what they do is they match you. So if you're a caregiver, they will try to match you with another caregiver of somebody with a similar cancer and similar situation. Or if you're a patient, they do similar matching as well. And you can sign up to be a support. So if you are a caregiver and you feel like you've been doing this a while and you have some expertise to share, you can sign up to be a support for somebody else, or you can also receive support in that way as well. So those are just some options for trying to address the stress that comes with caregiving and trying to manage all of the roles that, life has handed to you as well.